So we're also going to be talking about this thing called efficacy. So I think all that really means is for people at home is does the treatment that we're going to be doing is it the effect of it what it's proposed to be? So it doesn't do what it says it's supposed to do. Would
Yeah,
that be accurate, Ian?
yeah. It's like in efficacy means like in ideal circumstances, is this thing actually working? Yeah.
Right. So I guess the best question here is are arthroscopies and meniscectomies efficacious?
Well, the best evidence we have is that they're not. Now, having said that, they're done for many things, but by far the most common reason to do a knee arthroscopy is to remove part of the meniscus. And by far the majority of those are done in older people, and most of them are done in people aged over 50. So we're really looking at surgery for degenerative menisci, split, cracked, torn, whatever you like to call it, menisci in people who have knee pain. Now, there's a couple of problems with doing that procedure. On the surface, it sounds good. Somebody comes to you with knee pain, you do an MRI scan and you see a crack or a split in the meniscus. Now, it's normal for human beings to try and make mental shortcuts. This is hardwired into our brains. And when we see two things next to each other, we always want to associate them. So if we see somebody with knee pain and then we see a split or a crack on an MRI scan of the knee, we assume that that split is causing the pain. And most of the time that's wrong. So for example, most people with a meniscus tear don't have knee pain. And the two are not well correlated at all.
Right, right.
And yet that's our assumption. And so we charge in and we remove the torn piece of meniscus. But very high level evidence from randomized trials, from many comparative trials where they've compared people who have had knee pain and a torn meniscus and done either an arthroscopy or physical therapy, or they did an arthroscopy and a placebo arthroscopy. And so the patients didn't know whether they all had an arthroscopy, but only half of them had the meniscus removed. And the patients didn't know whether they did or not. And so everyone was blinded in that study, and it showed absolutely no difference whatsoever in the proportion of people that got better, how they felt afterwards, how much knee pain they had afterwards, what symptoms they had afterwards. It was exactly the same in both groups. So removing the meniscus or not removing the meniscus made no difference at all. And that is about the best test you can do of efficacy.